I'm pleased to welcome to our studios today two nurses from our area. They are both registered nurses in the Wilkes-Barre area. Heidi Roan Stempian is from Benton and Ashley Wheel is from Dallas. And they recently attended the Nurses Take DC March and Rally for Safe Staffing. Heidi, I'm going to start with you. Tell us how this went. It was for 5 days you were gone, all for a special cause.
Yes, so we actually went from Philadelphia to Washington, D.C. We had several rallies. We rallied in Philadelphia for safe staffing, and then we went to D.C. We were on the front lawn of the Capitol. This all took place because nurses around the entire country are fighting for safe staffing limits. A lot of people don't realize that their nurses can have unlimited amounts of patients at the moment. There is no law protecting us. There is no law protecting the patients. There are laws protecting children in daycares. There's a number of how many children a daycare worker can have healthy children. There's a law saying how many dogs can be in a dog kennel at one time, but there is no law stating how many patients a single nurse can have at one moment. It puts patients' lives at danger. It puts nursing license on the line. And it's just, you can't properly take care of a critical patient while trying to take care of other patients. We want to fix this and bring this light to our community, because at the end of the day, this is our family, our community. It's who we are as nurses, and we just want to fix it.
Wow, I did not know there wasn't any limit on that, so that is news to me. The only state you told me that does have a law that limits it is the state of California. And Ashley, you told me you know some nurses that actually moved to California because of this.
Right, we had a few of our coworkers, a couple of our friends who joined some travel agencies just to try to get some exposure, to see what else is out there besides what's going on here in the state of Pennsylvania. In their travels, they've learned that in California, the limits really protect them as nurses. They protect the patients. They're able to give better care, quality care, and get back to the basics of nursing, which is making people well.
What was the reaction when you did have a chance to see the governor, and so what was the reaction after you told them why you're concerned?
Well, the governor, among all of the legislators, it seems that this is always a surprise. Whenever we talk to anybody in Congress, anybody at the state level as well in the House of Representatives, they are surprised that it doesn't already exist. Everyone seems to think it's a common sense solution, but trying to get people on board with being the face of it in legislation has been pretty difficult. Even though it is a common sense solution, you would think to say, wow, the nurses really need a limit on how many patients they can care for to give good care. They also see the financial aspect of it and understand that it's going to hurt the hospitals. So what we want to make public, and what we really tried to drive home with the legislators, is the public is our first priority. My patients are my first priority, my family, my community, my friends, and that's what makes money for the hospital, not insurance companies. So we're trying to make the patients better.
Wow. Well, we're getting low on time, but Heidi, I did want to say there are two bills that you are hoping will move forward to help out this matter.
Yes, so there's the actual safe staffing bill that would make limits for patients to nurses. And then there's also the transparency bill, because a lot of people do not realize that this is not a public knowledge. I can't physically say to someone, I have 9 other patients, or I have 3 other patients, or 4. So the transparency bill makes it that the hospital has to tell the patients how many patients to one nurse they have at the moment.
This is a very complicated matter. I know we can't do it justice in 4 minutes. The ladies will be back to talk more about this concern, but I wish you the best of luck in your endeavor. They are on a mission to make sure there is safe staffing for all hospitals in Pennsylvania.